Hello. So, as an example of best practice related to assessment and course objectives and Web2 tools, I thought I would share a couple projects that I did when I was obtaining my master's certification for online education and as best practice and what we can do for teaching in our class. So the first thing I did is develop a taxonomy table utilizing Bloom's taxonomy and terminology, relating it to course objectives, and then a activity that would relate to that level of Bloom's taxonomy. After I did this, I put this in a concept map and I did create a rubric for one of these assignments. So in this particular assignment, we were looking at MedSurg, medical surgical nursing. The book was by Lewis, and the whole chapter was on immunology. So we were covering the immune system and cancer treatments, cancer emergencies. So starting at the basic level of Bloom's taxonomy of knowledge or slash remembering, I tried to find a learning activity that would be at that level, and using objective verbs from that area, I chose selecting and matching. And in this case, the students were to identify 5 types of immunoglobulins and answer the quiz at 100%. They took this quiz on a Web2 tool on QUIA.com, and it's a free site where you can make up quizzes and embed them into your class. And this was, again, a basic example of using matching course objectives at the knowledge level and finding a Web2 tool that the students could use at that level. Then moving up to application and applying, students, I picked the words demonstrate, illustrate, and construct, and tried to find a Web2 tool that they could use to accomplish a task and be graded on at that level. So what they did is they viewed a YouTube video, and then they needed to determine the basic components of the immune system by illustrating a minimum of 8 to 10 components on a concept map. Now there's many Web2 tools where you can find concept maps. Many of them charge, but you can also make a concept map in Word, and these just kind of have some of the pieces there for you. One of them was Poplet, and so the students were to do that on this Web2 tool site. Then the next, moving up Bloom's taxonomy, at the analysis or analyzing level, the words that were chosen from that level were examine, distinguish, and illustrate. And this was looking at cancer treatments. And they were to examine the relationship between chemotherapeutic medication and cell division, which is located in your skin, GI tract, and bone marrow, and distinguish the cause and effect of the medication and illustrate this relationship in a PowerPoint presentation or Prezi, and then they were to post that to the discussion board. Now, each of these projects would have had a specific rubric attached to determine if they met these objectives. Finally, the synthesis and creating level, which is the highest on Bloom's taxonomy list. The words chosen from and that correlated to the course objectives were summarize, construct, and explain. And in this case, they were to view a case study and on cancer emergencies and summarize one of the cancer emergencies. There's about 4 or 5, and construct a video on Adobe Voice and explain the pathophysiology, clinical manifestation, diagnosis, and treatment. So basically, kind of like the PowerPoint presentation that I talked about in the past video, they were to do basically about the same thing. But in this time, instead of doing a PowerPoint presentation, they were to use a video and make some type. They could use PowerPoint or they could use some other means to present their information. So that is a table, a taxonomy table where you can actually look at your levels, list your objectives, and incorporate them and find appropriate leveled Web2 tools. then this assignment or these basic assignments, I put into a concept map. So it's telling the student to do the same thing, but it's in a concept map. The reason you would use a concept map is that sometimes it makes it easier for the students to understand the assignment. It's sort of a blueprint as far as what they need to do for the course to get these grades. So it's just a basic overview of your assignment. And then finally, I created a rubric for the last. Now, like I said, there would have been a rubric for each one of those um, projects. This one was on the video of cancer emergencies. It has the criteria listed here and that different performance levels. So it's exemplary, proficient, and below expectations, so that it came out to 100. I used multipliers. And this lists what was the expectation in this criteria. Again, I used numbers 4, 3, 2, or fewer. This looked at format. This looked at what do they use as far as media to describe the disease process or clinical manifestation. So did they use pictures? Did they use something to enhance that presentation? And then their APA format. And one thing that I think is important to note about using Web2 tools, they're great, but always keeping in mind, does the learning of the tool outweigh the learning of the concept? So sometimes students can get so caught up in the tool or frustrated with the tool that they don't really get to the learning, which is what they really need to do. So this ends this presentation. If you do have any questions, I will answer them after the presentation. And once again, thank you for listening.